Hello and welcome to Health vs Wealth with Dr. Ben. I want to thank you for being a loyal listener, so we've made an end-of-year treat for you. Best Bits compilation of my guests and their work-life balance. Now, striking that balance is not easy, especially if you're a workaholic like my guest who works 364 days a year, or my guest who never takes a holiday because he finds them boring, or my guest who built a gym in her home but never uses it. She just walked through it on her way to her study. A very happy new year to you, and I hope you'll join me for more shows in 2025. I'm delighted to be joined by a guest today, James Carroll. He's an entrepreneur with a very interesting, hard work-life balance. He's 61. He's the founder of the Thor photobiomodulation company, which uses lasers to heal and to improve pain. And he has an interesting work-life balance, which is why he's on the programme today. He grosses 10 million a year in sales. He has 5,000 customers across 70 countries, and he's currently in his 30th anniversary of the company. He is a businessman who prioritises wealth, and I'm very interested to find out about how that fits in with working 364 days a year. James, you're a very busy man. How many days off a year do you think you should take?
Should take? Oh, I don't know. That'll be down to individuals. For me, I only plan one day off a year.
What day is that?
The Christmas day, of course. So I'm very much mission driven, and I'm very much in work with people I love and people and love the benefit, and we collect a lot of feedback. And if you can find something which that excites you every day, yes, you never have to work a day in your life.
But you were on the road, so the very thing, poor diet, poor sleeping patterns, and going from just show to show to show and then intermittently into studios, wrong hours. But of course, when you're in your mid-20s, you think you can do anything. You think anything and everything is possible. What you don't think at that time, so I think education comes in, is that what you do in your 20s and your 30s and your 40s will impact you in your 50s and your 60s. But nobody tells you that.
It's a bit
scary,
like
pension. It's a bit like pension planning. Nobody thinks of pension planning 20, 30, 40 till they're 50.
Tell us more about how you balance your work and your life. This is health versus wealth. Yeah. You're the busy father or daughter. You want to run this family. You also want to make sure your company is developing. Yeah. How do you balance these things out in your own personal life, Dean?
Well, it's very much a culture that you set both in your personal life and at work. The guys know when not to book me an appointment. My job is to go out and network now and get more business for the company whilst they implement the business. They do everything else. But equally, my diary, everything goes in the diary. So my daughter's appointments, when I have to pick her up from school, when we've got other appointments, they're the key ones. I've even been to her school and done a talk on telecoms and things like this. I've done that at a few different schools and for different students. I built the business around family, and family is important, and it's got to be what it's about. What's the end goal to having a successful business? The end goal is to be comfortable and to have a decent family life. That's mine anyway.
I hear that you're actually singled out by Rishi Sunak for this birthday honours list, and you got the British Empire Award. Did you get to meet the King himself?
Well, I have met the King, and I met him at Buckingham Palace.
Wow.
And it was really interesting, to be fair. Actually, it floored me a little bit because all I ever felt all my life is that he's very tall, because you see him next to William, right, who looks super tall.
Yeah.
And he's tiny.
Is he?
He's tiny.
I didn't know that.
Seriously.
He wasn't. Was he having to stand on a little sort of pedestal or something?
No, he's not much taller than me.
Wow.
And I'm 5'5". So yeah.
That's the best kept secret.
So maybe he's hunched over now, because when you get older you start hunching. I don't know, but he wasn't tall as I imagined him.
It's all about prioritising both the sort of the self, the family, and work, whether it be you are the employer or you are an employee.
Yeah.
I think really understanding those three different dimensions and then prioritising what's really important to you on all of those fronts. Before I got COVID, I think I did a fair job at that, but what's different now is back then I didn't feel like I had any limitations. I obviously did, but I didn't feel I knew I could push myself. So I was always pushing on every front.
Okay.
Probably overstretching myself. Didn't feel it at the time. So now it's very much I'm so acutely aware of my limitations. So that prioritization is right at the forefront of everything I do every day. And it's a great skill to have.
Now, Jazz, you sound like you've got loads of spare time, because as a part-time thing, you just took on a new role as a CEO. So you've taken on a lot of work responsibility. How are you managing your work-life balance?
Do you know what? I get asked this quite a lot, to be fair, and I ask myself it as well. But when I took the role on for CEO for Titan Partnership, I was already running a radio station, and I was running the Education Awards. I'm also a trustee at Solihull Moors Foundation, a charity there. So
just a few hats.
Just a few hats, and I sit on the board for Solihull Chambers, so Chamber of Commerce. So, it's really bizarre, but I think looking at it on paper, people may look at it and go, "This is bonkers." Absolutely crazy, but for me it's really taught me to work smarter, and all the things that I do actually integrate and they work in synergy with one another. So for example, with the radio station, I host 3 radio shows, and that's Talking Business, Talk Education, and the Hospitality Show. And Talking Business and Talk Education are the 2 main things that I'm really passionate about, that I work on for the Education Awards. So I'm not doing any extra work.
So the crossover gives you synergy and energy to feed into the
Absolutely. And then also as well with the Titan Partnership, I'm day in, day out talking to all the people in education, and I'm talking to educators, I'm talking to other businesses, and the synergy is there.
If you were speaking to someone and they were, flat out in business or career, and they might be prioritising their wealth creation over their health, what would you say to them? What would your message to them be, Steve?
This is a bit of a cliche, which I've borrowed, so apologies for that. But I've heard it said before that no one ever gets to their deathbed and says, "I wish I spent more time in the office."
Welcome to Health versus Wealth with Dr. Ben, where each week it's my great pleasure to meet fascinating people who tell us about the challenges they're facing with their work-life balance. I'm Dr. Ben Sinclair, and I wonder, do you struggle with your priorities? On the one hand, focusing on your work, business or career, namely your wealth, or on the other hand, looking after your health, which is so important. Over the past 20 years as a GP, I've seen many people spending too long on their screens, cutting corners on their sleep, diet or exercise. The result? Their work life's going well, but their health can suffer. I sincerely hope that my guests' personal and professional experiences may help you to improve your own health and life. I'm delighted to welcome today my guest, Elisa Astorri, a distinguished and experienced London rheumatologist with her own rheumatology clinic called Rheumatology Harley Street. Welcome, Elisa.
Thank you. Thank you for having me.
Thank you so much for visiting us on the podcast. And what conditions do you specialise in?
So I specialize in all autoimmunity. Autoimmunity happens when your immune system, instead of fighting viruses and bacteria, so enemies outside your body, decides to fight your own body. And this can cause a number of diseases like rheumatoid arthritis, Ankylosing spondylitis, psoriasis, thyroiditis, but I also cure any sort of joint pain, so back pain, gout, lupus, connective tissue diseases. Has a long list. Rheumatology is a very systemic, so it covers all the body.
Wow. And just for the benefit of the listeners who aren't quite sure what the medical term rheumatology is, can you explain it in really simple terms?
Joint pain, I guess. Any kind of joint pain, yes. And most of the time it's caused by the immune system.
Lovely. And people have talked about inflammation, a word people might understand that is part of that.
Yes.
And how do you look after your patients in terms of what you do for them?
Well, patients arrive to me usually already with a diagnosis because they are referred by skilled GPs. And I make sure that, they are beside a path, and I make sure that we are on the right treatment and monitor, and usually rheumatological conditions are chronic. So they are with me for a long time, and we build our relationship and trust, and we stay together for a few years.
That must be very satisfying to develop these deep relationships with patients. And at Dr. Finley's, we love to treat people holistically and understand them really well.
Yes.
So it's so good to be speaking to you today and seeing those similar values. You were born in Geneva, and you studied in France. Your grandfather was a surgeon. Is that why medicine appealed to you?
No, actually, no. And you forgot to say that I grew up in Italy.
And you grew up in Italy?
Yes.
How many languages do you speak?
A few, yes. 4 or 5 languages, yes.
Just 4 or 5?
Yeah, no, I grew up in Italy, and being a doctor was always in my DNA. Can we say that?
Absolutely.
It was something I always wanted to be, and it's who I am, I guess. It's part of my identity, I guess. Yes.
Now, as doctors, we're all very committed to our patients, but I gather in your lifetime you've had some interesting experience and taken this to a new level. Can you tell us what happened on the way back from your honeymoon in an airplane?
So many stories, but this is a funny one. I was coming back from India with my husband, and sometimes they call, is there a doctor on board on an airplane?
My heart always skips a beat when that call goes out.
And so I went. I had nothing to drink, so I was the only one probably. And the airplane asked me to sign a disclaimer that so I could have access to all the medical equipment to help this gentleman. And the captain asked me to spend the rest of the flight with him. So
quite a commitment.
Quite a commitment, yes. So we couldn't land because we're flying over, I think, Afghanistan, or anyway, somewhere we couldn't land. So the patient was fine. We landed. He was happily taken. My husband wasn't, because, of course, he didn't see me for 8 hours.
You left him on your
I left him after coming back. For another man. And also he saw that I signed this paper that I took all the responsibility without,
The legal aspect is sometimes quite scary, isn't it?
Yes.
Did he ever sue you?
No, I had no suing, and but no, not even a card, and I was disappointed.
It's important for people to be thanked for these Good Samaritan acts.
It is.
I once helped a lady on a train, and the guard kindly upgraded me to first class, which was lovely.
Oh, at least that.
Yeah, so I'd only for half an hour, but it's the thought that counts.
It is.
Rheumatology Harley Street, you're based in London, but what countries, where do your patients come from?
They come from all over the world. I saw a patient from Sweden yesterday, and I see patients coming from the US, from all over Europe, from Middle East, really everywhere, not just the UK.
And tell us more about how you use your experience to help these people who are coming from around the world.
Yes. So I started as an academic. So I studied medicine like everyone, and then I decided to do 2 PhDs. And this is another thing, don't tell my husband, just said, stop studying, Elisa.
So you're doctor.
I'm doctor, yes. And then I went into clinical trials. So it was really interesting to translate what I learned in the lab into actual clinical trials. So testing drugs on patients, and all this went into my clinical practice. So I bring a lot of science and a lot of academic studies, and maybe the mentality of, a scientist into the mentality of a doctor. So,
and I have to confess, we do work together. We met through a mutual colleague in medicine, And it's really lovely to work with someone who's at the cutting edge of the science advancements in rheumatology. And at Dr. Finley's, we believe we launched the first UK online long COVID clinic. And I know you deal with long COVID as well. So can you tell us a bit more about how you help the long COVID clinic patients and those cutting edge things that you do for them?
Yes, of course. I have to say you inspired me. So I have to thank you for that. And this mutual friend. And because long COVID is not a rheumatological condition, but the drug we use to try and help our patients are monoclonal antibodies, which is a funny word, but is a type of medication that we use a lot in rheumatology. So I think I used my experience to help your patients and many other patients. So this is how I think our different fields merged and how we could help each other and our patients.
So if you're just joining me, my guest today is Dr. Elisa Astorri, a distinguished London rheumatologist with her own clinic, Rheumatology Harley Street. Now, Elisa, we were talking about long COVID. It's a passion of mine. I was affected by it. And I met you because we were trying to find solutions for patients with long COVID. And people may not realise that people are still being affected by COVID. The numbers are rising. And the UK alone, there are over 2.3 million adults and over 70,000 children affected with long COVID. And in America, they estimate 30 million people. So this is a huge problem.
Yes, you're absolutely right.
And we're looking for solutions. And for people who aren't aware, long COVID is characterised by fatigue, a crushing fatigue, and neurological problems that interfere with activities of daily living. A lot of my patients can't work, sometimes can't even look after themselves. So treatments in this area are really important. Now, I was introduced to you because of this treatment.
Yes.
And so tell me about the treatments that you've been pioneering.
So in rheumatology, we use a lot of monoclonal antibodies, which are called also biologics. These are drugs that are super high technology. You can picture them like flowers that open and they are able to capture whatever molecule they are designed to capture in your blood. So I was using Evusheld, which is one of these monoclonal antibodies, to give immunity to my patients who didn't have an immune system. So it's instead of a vaccine. And it worked fabulously. I would say more than 600 patients without an immune system didn't catch COVID. And then what it does, Evusheld captures the spike protein. When we met, we were looking for a reason why patients without COVID still had really high levels of spike protein. And we thought that maybe the vaccines, the RNA vaccines, were still working in some patients. They didn't stop working. So the spike protein was still being produced. And this is how Evusheld would be beneficial, because being a monoclonal antibody would capture the spike protein and clean the blood from it.
And it seems to be working for some people, which is really exciting.
Really well.
And those people might be people who are producing too much spike protein, which is what the mRNA vaccines tell their cells to do. Or they may be people who aren't producing their own antibodies to a COVID infection. So the spike protein carries on being around because they haven't got rid of it themselves.
Yes.
So this medicine helps to get rid of the thing that causes all the complications we think of long COVID.
What I say, it cleans the blood, if you want to say it in a simple way.
And this is so exciting. I've just come back from a conference in Munich all about other co-infections that also are kicked off by acute COVID and damage the immune system. Things like EBV and other bacteria that hang around in the system and then suppress the immune system. So we are so excited about Evusheld, and there are new monoclonal antibodies, these synthetic antibodies being produced all the time to try to bring us forward in this area. It's so good to be working with you because you're brave enough to pioneer these things. And as someone who suffered from long COVID, I'm desperate to find solutions to for my patients.
Yes, and we will keep trying. And I think we've had amazing results up to now. And the science behind it, which is our science, I think, it's proven to work. So...
And we're also working with Exeter University on a test that helps to understand whether someone has produced their own immune response or if they're having this poor immune response. And that will tell us whether they might benefit from these monoclonal antibodies. So we're really excited to have a test and a treatment which might be solving some of the problem of long COVID.
Yes.
Now, Elisa, we have been hammer and tongs at long COVID, and it's not just long COVID you do. You're a busy London rheumatologist. As a busy professional, we both have 3 children. You have 3 children.
I do.
How's your work-life balance?
Well, I always say that I made peace with my work-life balance. There is no solution. You're always in the wrong place.
Okay.
You're either at work and you should be, with doing homework, or you're with them and you should be reviewing blood tests.
So you're always pulled in 2 directions.
So you're always pulled. So I don't know if there is a balance. The balance I found is with myself. Like, there is no solution. But once you make peace with yourself, I think you find the balance.
Interesting. So you've accepted the balance, and you're a true vocational doctor.
Yes, and I think it's a good example for my children to see, dedication, and there is that side too.
Now, I hear your kids sometimes inspire what you eat, because sometimes as doctors, we're so busy, we haven't got time to cook. What do you find yourself eating?
That was a secret you were not supposed to say, but... Yes, it's true, and I'm not going to lie. I'm not going to say that I have the best diet, but yes, sometimes I come home and my meal is what they leave me, so leftover is perfect.
Now, Italians love good food. Tell me what you're actually eating off your children's plate. Come on.
Whatever they leave, it can be chicken nuggets.
No.
It can be pasta. It can be fish fingers. It can be anything.
So some ultra-processed stuff in there.
Yes.
By necessity. Well, I think it's good for people to see sometimes when you're working so hard, we haven't got time to make a choice about what we eat.
We're humans. Come on.
Yeah.
Sometimes we're tired too.
Exactly. And I'm blessed to have a wife who cooks for me, and I don't have to think about, because she puts some good food on the table. And I had to stop myself from eating my kids' leftovers, because I have this guilt thing that I inherited from my parents, that you should never leave food because someone will always go hungry. This post-war mentality. But now I realize I'm not a dustbin for other people's food.
I will do that then next time. I will think about that.
Yeah. And I think also we are what we eat. The Van Tillikens have done this ultra-processed people book, and, showed us the negative effects of these ultra-processed foods.
Don't make me feel so guilty, please.
But it's okay. We have a chance to change it.
Yes.
So maybe with some planning, we can both work on having healthier food,
of course,
available. And obviously, we're busy, we get stressed. How's your sleep? Because I've got young kids, they keep on interrupting me. Are you getting enough sleep?
No, I do get enough sleep. At least that I do. It's very important for me, and it's very important to be able to wake up and be focused. And so at least sleeping and exercising, that at least I can tick those boxes. Dinner, not so much.
It's good. Now, one of our previous guests was the publisher who has invited me to write on sleep in the Business Influencer magazine. So we did a whole article all about different things that can help sleep. What habits do you do that help you get that good sleep?
Well, again, I follow my children's habits. So when they go to bed, I, switch all devices, try to avoid screens, and try to keep a very good routine, and it really helps.
And I think often we forget that we're just plugged in 24/7, and actually those screens demanding our attention and the blue light coming out of them, creates that wakefulness, it's really negative impact on our ability to wind down.
And routine also. I think routine is reassuring for children as much as for adults. So,
do you have any particular wind down routine that you do?
No, but my routine is, read a book to my children and then put them to bed, I guess. This is winding me down as much as them.
It's quite calming. I sometimes find I've read the book and then I fall asleep in the bed.
Of course. I didn't want to say that, but yes.
It's what happens to me. So
it happens to me too.
We can confess our lifestyle sins here on the programme. And the thing is, this is reality for many people. We are the pressure generation. We have young children. We have older parents to look after. We're at the peak of our careers. It's no wonder that we end up falling asleep at the wrong time if we're so tired.
I can suggest some books if you want.
Thank you. Well, actually, one trick I heard was to leave all the medicine books and all of the business books or the self-development books out of the bedroom. And now I just have novels and interest books next to my bed. And I have to say that it puts up the good kind of emphasis on this is relaxation reading. And I find that really helps me just drift off. I get into the story. I like naval history books, so they're wonderful. Now, my watch, I see we're both wearing Oura rings to measure our sleep stats.
We are.
I love it.
We are.
So these things give us a score. But what would you score yourself on overall in terms of your well-being and health?
I think I'm an 8 from,
That is a strong score.
Yeah, I think I have a good routine and I think I really enjoy my job. So I think this helps as well. And I would give it an 8.
That's
regardless of the chicken nuggets.
That's good. But I think actually that's the highest score we've had on the program. So I'm going to give you a virtual medal now.
Oh my God! Thank you so much.
Because I think you scored the highest, work-life balance and well-being score that we've had on the show.
Well, the Oura can confirm that I sleep and my resting heart rate is always under control. So I think this really helps.
I think it's nice to have that feedback from a device. The good thing with the Oura Ring is you're not looking at a screen. You can just refer back to it.
Exactly.
So it informs you, a bit like AI informing, sort of helping you confirm your theory, your diagnosis. Yes. I find that the feedback can be useful.
More about recovery rather than activity, which is what I really like.
Yeah, because I think with different devices, I wear a Garmin watch for my triathlon activities, but I find this one makes me feel guilty because it's saying you're not doing enough, your athletic ability is going down. But the Oura Ring is encouraging. It's like, it gives you these little messages like, hey, maybe you should take a rest today. You're looking a bit tired.
8 hours.
Or it gives you a medal and it goes, well done. Like last year, my Oura Ring told me I had the year of sleep because I had a score of 89 on the sleep score, consistently average. Because one of the things with long COVID, I really got into sleeping well because that deep restorative sleep, absolutely crucial. And in business, and the reason why I wrote that article about sleep underpinning success, because if you don't process, you don't have downtime, your brain can't recover, your creativity, your subconscious can't generate the ideas that might be life-changing for other people.
Of course, I fully agree.
Well, Elisa, it's been so interesting talking to you, and I love working with you on long COVID. I want to thank you for coming in today to speak to me. And that's all we've got time for today.
Thank you so much for having me. Thank you. It was a pleasure.
So I do hope you enjoyed today's episode of Health versus Wealth with Dr. Ben, and I hope it may help you improve your life and health. You can also take one easy step by achieving that right now by subscribing free on your usual podcast platform. And if you'd like to be a guest on the show, you can email me on podcast@drfinlays.co.uk. I hope you'll join me again, but for now it's goodbye from me, Dr. Ben.